If you're dealing with general back pain, hip or SI joint issues, and your doctor has not told you that you should be avoiding certain movements, then you're likely going to find relief with Pilates pretty quickly, because this program will strengthen and restore the entire hip, low back, and core region, all those little small muscles that we need to hold us up. So you'll be regaining the support you may be missing. I do have 3 important things to remember, though, while you're practicing. The first is, when you're doing exercises, you're going to want to avoid any range of motion that brings you pain. So that simply means if you're doing a leg circle, you want to make it small enough that you have no pain. And if you suspect a movement might hurt, then just skip it entirely or do a very simple version. And that's my second tip here is, if you're doing an exercise and you go to the next version of it and it becomes too difficult, or you feel like you're going to have twinges or pain from it, go back to the simpler version. And in the pre-Pilates, in the beginning series, you're going to find that doing exercises where we do one leg and then the other is a little easier than going with both legs, because both legs is heavier. So that's going to help you in those cases. And also, you're going to really want to continue to take all of my tips. Like, for example, when I explain how to use a towel under your lower back to help with some exercises like rolling up, or just to give you a little bit of proprioception to pull into while you're doing your exercises, that's actually really important for you to try and not just skip or avoid because you don't think you need it. Finally, my last tip is, if you really dislike an exercise, that's probably because you need it. I used to personally really hate all of the arching exercises, swan dive exercises, until I realized I wasn't slouching anymore. So, what does that tell you? So again, this is all about patience and practice and really allowing your body to do the things it needs to do to get stronger, because likely you haven't been using these little bitty muscles and all the support system that holds you up. If you've been sitting a lot or out of condition, then that's the case. So I hope you will take these tips to heart. Of course, if you're having severe pain or a lot of inflammation, please go see a doctor. Just using common sense is the key there, because you don't want to do exercise that might make things worse. All right, leave your comments for me below if you have extra questions.